Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, every week I have a different guest on this show, and we talk about different programs, services, things that are going to be of interest regarding your health. So I hope you'll stay tuned because I've got another exciting guest on the program this week. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jennifer Rosebrock, who's our breast health navigator here at KRMC. Thanks for being on the show, Jennifer.
Sure, thank you for having me.
So we were talking before the program started. It's been almost a year now. I think we're on the program right after you started.
Yep.
Probably didn't know what you were getting yourself into back then, huh?
No.
And here we are in October where the whole month is pink.
Yes.
Last week we talked with Terry Williams, and she shared with us all of the cool things that are going on for breast cancer awareness here in Kingman. Mm-hmm. But your job is year-round, not just in October.
Absolutely.
And so let's start talking about first what your role is as breast health navigator. That's a big title. What does that mean?
Well, and it does. It encompasses a lot of different things.
Okay.
I'm housed at the imaging center here at Kingman Regional physically, but I work with a lot of different women, not just there, but also out in the community. Part of my role is to make sure that when women have any kind of abnormality on their breast imaging, that we explain to them why we want them to come back for follow-up, and that I assist in any way that I can to get them back.
So from the very beginning, and it's not always necessarily a bad diagnosis sometimes, right? It's just maybe a false positive.
Right.
Okay.
And that can happen, and so educating people that, the majority of those women that we call back for more follow-up are okay, but we want to make sure.
Better safe than sorry.
Right.
And what's really awesome, of course, with our new 3D tomosynthesis is how early we're able to find those tumors.
Absolutely.
Diagnosed so much earlier than ever before. And we've talked about how that early diagnosis can really have a major impact on the outcome. Right.
And that's part of my role too, is educating about that and the importance of screening and finding something early so that it doesn't have to be such a big deal to go through the treatment.
Right. A simple procedure, maybe even just surgery to remove that lump versus having to go through chemo and radiation.
Right.
That whole thing. So what kind of outreach do you do to educate women?
So I go to different events in the community. Of course, a lot of those events coming up in October that you talked to Terry about, I'll be there just informing and educating women about the importance of doing their screening for breast cancer, and what resources that we have available to help them if they need help, not just financial, other support services too. And then I also will go to different group meetings around town and do a short presentation and answer questions that women have about screening and about how they can get scheduled or get follow-up or any kind of question that they have.
Okay, well, and that's good for folks that are watching this program. They might belong to Rotary or Kiwanis or the Elks, looking for guest speakers, so they could call you.
Absolutely.
You could come and talk to them. We'll give your number out many times during the show, but what is it right now?
It's 928-263-3905.
3905.
Yes.
Okay, very good. So they could call you if they'd like to set you up as a speaker.
Absolutely.
I know there's some church groups that have monthly meetings that might like you to come and talk. So that's great.
Right, and I'm going out to Meadview next Thursday to talk to their group there.
Excellent.
And I spoke with Sir Optimus last Thursday.
Oh, very good.
So I've been doing a little bit more of that, trying to work that in.
Yes, amongst all your spare time.
Yeah.
I know that when referring back to Terry all the time, but when she was here, we were talking about how 1 in 8 women can have a diagnosis of breast cancer.
Right.
That's a scary statistic.
It is.
And we talked about being in a small community like this. It pretty much touches everybody because with that 1 in 8, that means pretty much everyone has at least a friend or a friend of a friend kind of thing. They know someone who's been touched.
Right, yeah. It's one of those things where you're hard pressed to find somebody who hasn't been touched by breast cancer or cancer alone. But yeah, with women, they have a 1 in 8 chance in their lifetime they'll be diagnosed. And so it's important. We don't know everything. We've come a long way, but it's important to do that screening like we just talked about earlier.
Right. So now, if we'll do a scenario here, if I had gone in for my yearly exam and had a positive result, and you're going to call me and talk to me, well, go ahead. I'll let you walk through it.
You'll hear from either me or from your primary care provider. I work with those providers here in town.
Okay.
So one of us will call you and explain that we want you to come back and explain why and answer any questions that women have and try to calm some of the anxiety and fear that comes along with hearing that.
Yes.
And then we'll work to get you in. We have to get an order from your doctor for any kind of follow-up that has to happen. We always do that to make sure insurance authorization takes place.
That's good.
And that everything happens in the proper order. And we usually can get you in really quickly, and you come back. Usually if you have an abnormal screening mammogram, your yearly exam, then if we call you back, you're going to have what's called a diagnostic mammogram and possibly a breast ultrasound after that. But one thing I like to tell ladies is when you come for that follow-up mammogram, you know the outcome when you're there. And that helps, I think, women sometimes. They don't have to go home and wait 5 to 10 days for a letter to come in the mail or to hear from their doctor.
So now, is that procedure any more uncomfortable?
Not necessarily. You won't notice a huge difference.
Okay.
They do have different techniques that they use. One of them that might be a little bit more uncomfortable, but it gets them the information that they need to know if this is something that's worrisome or if it's fine and the lady's okay to return to normal screening.
Okay. So then they go through that process, and if the next step shows that, yes, this is something we need to look further, then what happens?
The next step typically in most cases would be to do a tissue biopsy.
Okay.
And that in most cases can be done in the outpatient imaging center with what's called a needle biopsy.
Okay.
Where they just have to get a little bit of the tissue to look at the actual cells to know is there anything
for a pathology report to actually find out if it's cancerous or not.
Right.
Okay.
Right. And if it is, we help them get set up with next steps. We'll want them to talk with an oncologist and talk with a surgeon. Those are the experts, the specialists that help guide treatment, and treatment's all based on what they see in that tissue biopsy.
Okay. That tells them, and also probably how deep it is, the size, that whole thing.
Exactly. That the pathology and the imaging kind of goes together to give us the full picture of what's going on.
Okay. And so then, and you're there for that whole process.
Yep.
I mean, I'm guessing that you get to have gotten to know a lot of women since you've been here the past year.
Yeah, it's really neat. Everybody's a little bit different with how they handle it and look at the whole process. But I'm there for whatever they need, really, and to serve as one point of contact. Once you start having exams, you start to see different specialists if you have a diagnosis, and you don't always know who to ask. And so I can be a contact point for that lady who doesn't know who to pose a question to, and I may not know it, but I'll help them figure it out or let them know.
You know where to go to get the answers.
Right.
And that's sometimes as important as knowing the answer.
Right.
It's like knowing who to go to.
Right. So I'm constantly learning and building up my repertoire and who knows what and who's the best for what resource.
And so obviously the oncologist becomes very close with the patient as well, so they're walking them through the whole process. They go through chemo and radiation, and I think we're not doctors, so we're not going to try to diagnose which comes first, the chicken or the egg kind of thing.
Right, right.
And for each patient, it's probably a little different.
It is. Okay. Like I said, it's very much based on that pathology, what type of cancer. They have different markers that they look at that help guide them one way or another.
But then once they've started treatment and you're kind of making sure that things are proceeding the way they should, again, they can call you with questions.
Absolutely. Okay. And I try to regularly check in. I don't always do it as often as I want to, but I'll always confirm that they have my contact info, and so if they need anything, they can call me. But I like to keep in touch after a surgery, make sure they're doing okay and that they have those follow-up appointments set up, and just make sure. And every once in a while, I get a call and things aren't going exactly how they want, so then we say what's going on,
Okay.
we figure out how to fix it and how to make
Awesome.
things move more efficiently. So
Very good.
yeah.
Now, you've also started, I believe, or have continued a support group,
Yes,
right?
absolutely. We meet the third Thursday of every month
Okay.
here at the hospital in the
Okay.
Troya conference room.
Troya? Okay,
Yeah.
that's in the main hospital,
Right.
around from the cafeteria.
Exactly.
Okay.
And we
At
meet
what time?
At 5:30.
Oh, okay, so
from-
that's convenient for folks that are working.
Yes, yes, and we have a couple programs coming up in the next couple months that I'm excited about. A lot of times women just share and talk. Other times Shelley, the prior navigator who kind of helps me with the support group, and I just kind of come up with a topic and bring some info to do
Oh, good.
educational
so you have
things.
kind of different
Yeah.
venues for each one.
Right,
Okay.
and so I've talked with one of our physical therapists who's certified in lymphedema now.
Oh, that's
who's going to come
right.
speak.
That's great. That's
Yeah.
a whole new program we're
Yeah.
offering. Awesome.
So the ladies that come usually were very interested in having her come to speak with them about signs and symptoms and things to look for. And then I'm also working to get our dietitian from the Cancer Center to come talk about
Oh,
nutrition
great.
during treatment and after treatment. So
Okay.
we have different topics. We don't always have a topic, but we try to.
Right. And like you said, sometimes it's just a matter of being able to talk and share what's going on, what I'm feeling and thinking.
Exactly.
Anything.
And yeah, and they kind of form connections. They meet ladies that they haven't met through the process, and sometimes that's a bigger support than I could be, or a family member who hasn't gone through it.
Yeah, you're realizing what you're experiencing really isn't unique. I mean, each person's different,
Right.
but having someone that you can talk to who's gone through it or is going through it, I think always helps
Right.
a lot. Now, what about family members? Did they have a separate group, or
They can come as well. We
Okay.
sometimes have a spouse, or last time we had a lady's daughter come and join us, so
Okay.
they're welcome to be there as well with us.
Great,
Yeah.
great. And I think the Cancer Center has a support or a caregiver support group as well.
I think they
Right.
do. I'm not
Yeah.
sure when that meets,
Okay.
but I'm pretty sure that they do.
Yeah, and that's important, I think, too, for family members, especially if it's further along, if it's further stage 3 or 4,
Right.
where there's more health concerns involved. It's probably good to have a separate meeting for the caregivers because they need a whole different kind of support.
Exactly.
Okay.
Yeah.
So for women, obviously, we'll talk a little bit after our break about the Catch It Early program, but right now I wanted to talk about women who maybe don't realize the importance of that mammogram. And when are we supposed to have our first one?
Starting at age 40,
40.
unless
okay.
you have any problems beforehand.
Family history kind of thing, or if you find a lump.
If you find a lump, you definitely want to see your doctor. We spend time too educating it's not just a lump that you can find that can be worrisome. There are other signs and symptoms to
Okay.
look for.
Like what?
Like changes in the skin,
Okay.
especially kind of on the breast around the nipple.
Okay.
Discharge from the nipple.
Okay.
Sometimes inversion of the nipple,
Oh,
things like
those are all
that.
things that can be symptoms of
Right.
of
It can
problem.
be, there can be benign reasons that cause those,
Okay.
but that can also be something that's caused by cancer. So that's why it's
Okay.
important to work it up, to talk to your doctor first.
Sure.
And then you would get the diagnostic mammogram if they were concerned and wanted you to have imaging
Okay.
instead of that screener that we
Right.
first talked about.
Okay.
And then you would see, is it something worrisome or not, and we would work it up just like anything.
Okay. So that, but if you don't have a family history or any of those others, and we start at 40.
Right.
For, is that a one time at 40, or is it every year after
Every
that?
year.
Okay.
And our standards in the United States are to do it every year starting at age 40. With the family history, if you have a first-degree relative, so a mother, a sister, a daughter who was diagnosed before the age of 50, we want to start screening 10 years prior to when
Okay,
that
so like
person was
if it was at
diagnosed.
42, you'd want to start at 32.
Exactly.
Kind of thing. Okay.
Exactly.
So that's good to know. I hadn't ever really heard that before. That makes sense.
Right.
Obviously.
We just want to be
but
a little more diligent and
sure,
try
being
to
more proactive
Exactly.
versus being reactive.
yeah,
Very
yeah.
good.
Catch it early.
Yeah, absolutely. That's the whole point. Okay, well, we're going to take a quick break, and when we come back, we'll talk about Catch It Early and what we're doing there.
Okay.
So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jennifer Rosebrock, the Breast Health Navigator here at KRMC. Thanks again for being on the show, Jennifer. Every time I do this program, I learn something new, and it's just as educational for me as it is for my audience.
Yeah,
so
good.
I'm glad you're on the program.
Thank you.
Before the break, we talked about your outreach that you're doing out in the community. We kind of touched lightly on the Catch It Early program. So let's talk about that a little bit more. Part of it, of course, the whole focus of catching it early is the fact that if we do that, the outcome is going to be so much better
Right.
than if it's too far along and it's too late.
Right. We say we treat to cure if we can catch it at an early stage when it's small and hasn't spread anywhere else, instead of treating to kind of prolong. And
Right.
if we do those regular screenings, we know we can find it at an earlier point before
That's
you
great.
can feel it, or before you have some of the signs and symptoms that we
Right.
ask women to look for.
Well, and I know of women who have found a lump through their regular yearly exam, or, a mammogram, that was very deep and very small, and normally without our 3D tomosynthesis, it wouldn't have been probably found for a couple of years.
Right.
But with this new procedure we have, they find it deep and small.
Yes.
And so, again, that outcome is hugely improved.
It is.
By
It
doing
is.
that. So during October, we're doing the $65 mammograms, which that's most, I think, for women who have high deductibles, right?
For women who are either uninsured or have high deductibles, exactly, anything over $100.
Okay, so that they would qualify for that. Now, again, who do they call? I know we gave Terry's number out last week, but can they call you as well for more
Sure.
information?
Sure, absolutely.
And
I
what's your number again?
My phone number is 928
Okay.
263 3905.
So 263-3905.
Yes.
They can call for more information.
Absolutely.
About those $65 mammograms. And then, and just in general, about our breast health program that we're doing.
Right.
I really feel KRMC has done a pretty awesome job, not only of hiring incredible staff like yourself and Dr. Johansson, who's here, but putting these programs together and out there to help our community. Of course, Terry's done some great grant writing for us.
I was going to say, she wrote the grant for
Yeah.
for this program. It's funded through the National Breast Cancer Foundation,
Great.
and it's just a huge resource for our community.
No, absolutely, because we wouldn't have those programs if it wasn't for those grant funds
Right.
that have helped. Now, if a woman, and there's a number of reasons I'm sure that women kind of put off having their first one done. First, probably is just fear of the unknown,
Yeah.
not knowing what to expect, and
Right.
you hear horror stories, especially back in the old days. I mean, I think there was
Yeah.
Maxine, the cartoon, that
Yeah.
showed women, with their flat breasts.
Like a crank kind
Yeah.
of. Yeah.
But it's not like that. It really isn't.
Yeah.
It's not bad like that.
It's not. It's a quick thing. That screening mammogram is 2 pictures of each breast. Not the most pleasant thing in the world, but the benefit of doing it hugely outweighs a few
Absolutely.
minutes of discomfort.
Right.
And every woman's a little bit different about how they feel and sense
Yeah.
discomfort during it. But most
Right.
women say we've come a long way, and that's not nearly as bad as it used to be. Yeah.
So probably another reason that women put it off is lack of insurance.
Yeah, or
lack of
financial
funds,
reasons, yeah.
Right, for financial. And we have a couple of different programs
We
that
do.
help with that.
We do, and that's part of my role as well, is to kind of, if funding or if finances are an issue for you for whatever imaging that you need to have, I want women to let me know, because I can go to work and start helping them find what resources are out there. One of those is the Well Woman Health Check program, which many women have probably heard of. It's a breast and cervical cancer screening program, and they have income guidelines that they use to qualify you. But where they're a huge help and resource for us is women who come in and who've found a lump or have changes in the breast like we talked about earlier, but they don't have insurance and they need that diagnostic mammogram and possible ultrasound, and that's an expensive exam.
Right.
And so they can't afford to do it. And the Well Woman program, if they qualify, will cover that exam. It will cover a clinical breast exam with a physician or a primary care provider, which is very important. We want that to happen in addition to the imaging. And if there's any further workup, if there has to be a biopsy or anything, they'll cover that as well.
Wow, that's great.
So it's a huge program and a great resource for the ladies in all of our community. In addition to that, as you mentioned, we have the Catch It Early program, which we just kind of handle things on a case-by-case basis. Those ladies who don't qualify for Well Woman, if they're a little bit too above the income guideline, or if there are other reasons, that's another resource that we use that we get through fundraising and through grants that Terry has written for to help provide mammograms or imaging for ladies who can't afford it.
That's awesome.
Yeah.
That's good. Now, with the Well Woman, then, does it take it also to the next step? Like, if they have to have a mastectomy done?
If they have to have any kind of treatment, if you're diagnosed, and even if it's not through the Well Woman program, if you're diagnosed with breast cancer in the state of Arizona and you don't have insurance, if you qualify for their income guidelines, they will hook you up through what's called the Breast and Cervical Cancer Treatment Program.
Oh,
we
great.
call it the BCCTP. Everything has the acronym.
Yeah.
And they'll provide you with coverage so that you can get treatment.
Oh, excellent.
Yeah.
So that's, again, I think that is for a lot of women that I know of, that I've heard of, and where they know they don't have the insurance and the money to pay for it, and it's kind of the denial syndrome.
Exactly.
If I don't look at it and pretend it's not there, maybe it'll go away.
Right. That's what we do not want to
Right.
happen. We spend a lot of time with these outreach events in the community and at the meetings I've gone to speak with, educating not just about screening, but well, how do we get it? How do we do that screening if women have financial barriers?
Right.
We have options available to kind of help.
That's your key word, options.
Yeah.
That there are options out there, because I think women, if they found a lump or whatever, and they're so scared and they just don't think they have options or choices.
Yeah.
And that's so wonderful that you're there to help guide them through that process.
Right.
Put their fears to rest as far as that's concerned, obviously.
Yeah. And kind of helping them know what do we need to do and how do we do it. And, doing everything in my power to whatever barrier exists to find some kind of resolution to that, so that they get the important health care that they need.
Yeah, that's awesome.
Yeah.
So amongst all your other things that you're doing, and you're doing this outreach and support groups as well, those are all important programs that support the patients. And I just wanted to think if there's anything else that we haven't touched on that we should be talking about to educate our folks.
Right. Yeah. Well, I know you talked with Terry about all the events coming up.
Sure.
And we'll be out there, and if women have questions, they can always come meet me or
That's
meet Terry.
That's a good thing, because we'll still be a couple of weeks in October left here, and so they're going to see you out and about. And they can go, oh, that's Jennifer. I saw her on TV.
Right, exactly. And we're out, like you say, talking to ladies about options, and if they want us to get them in touch with the Well Women program or through our Catch It Early program, or get scheduled for one of the $65 mammograms, then I'm a resource to help make that happen for them.
Excellent. And we can talk again briefly that we're doing the buy a pink light bulb that they can do through the hospital that lights the pink ribbon, and that all those funds raised go to our Catch It Early program.
Right.
We do have grants that help pay for that, and the hospital obviously has funds earmarked for those kind of programs as well. But I think it just shows our incredible community. People want to help.
They do.
And want to be involved, and so this is just another way they can do that.
They do.
$5 buys a light bulb.
Right, and we've had a lot of women to do that, and they buy the light bulb, but they also sign our Pink Book of Champions that put a little note to that person. It's
I
really
forgot about
neat.
that. I'm glad you brought that up.
Yeah.
And then we're going to have that as kind of a keepsake.
Yes.
That'll be ongoing in memory of, or
in memory or in honor of, And we've been selling cookies in addition to the light bulbs. The cookie jars are very popular. And those funds also go to the Catch It Early program, as I'm sure you guys discussed.
Yeah. So that's awesome. And I'm excited that you're out in the community and just continually building awareness about our programs, and both the Cancer Center and the Imaging Center side of it, and how people can get involved and watch. So that's awesome. And again, let's give your number one more time. It's the 928-263-3905. 3905.
Yeah.
Thanks so much for being on the program, Jennifer.
You're welcome.
I really
Thank you.
appreciate it. I hope you learned something new. I know I did. Join me again next week when we'll have another great guest on the program.